allow for everyone to hop in. So, well, good afternoon, everyone. I am Tiffany Feingold. I am the co-founder of Guiding Bright Minds. I recognize many of you, so thank you for joining. I know you, because I think you come again to these webinars that you find them impactful and helpful on your journey. So I appreciate that support. Those of you that may not have been to one of our webinars, I want to share with you a little bit of my journey and a little bit about Guiding Bright Minds and kind of my own struggles as a parent, I guess, of a neurodivergent child. But first started actually with my husband, who grew up with dyslexia and ADHD, and watching him just overcome some of his insecurities. That lasted quite a while through his experience growing up in school and not knowing how to read and learning how to read and how people reacted to that and responded to that. And so through that, it gave me, I guess, an overview of what some of those, I guess, challenges can be. And then when we had our son, it started pretty early at 3.5, where he was getting, kicked out of daycares and swim lessons. And I think that was really loud, overwhelming, and overstimulating for him, and then watching in half-day kindergarten, where he's in the principal's office pretty much every day. And as a parent, and I was working in corporate America at that time, getting phone calls every day and wondering, how do parents navigate this system, and especially getting those calls. And when you see it pop up in your phone and your heart just sinks, thinking, oh my gosh, now what's going to happen now today? And what does that look like? How do I get an evaluation? Where do I go for an assessment? What does that mean? And so that's ultimately where my husband and I decided, let's create Guiding Bright Minds, and let's build a community where parents and professionals and educators come together to really partner to say, how do we help our kids thrive and survive in school, in extracurricular activities, in society. And so that's what we're all about. And, I always like to mention too, is I want to hear from you as well. So reach out to me when I send out a copy of this recording at the end. My email address is on there. You can also go to our website, www.guidingbrightminds.com. There's a place where you can ask questions, share with me your journey, or ask any questions you want for me to help you with your journey. And also, what other tools, resources, topics you'd like to hear about, because, I know I'm on the same journey, but all of us have different ones. So if there's other things that you would like to learn about or know about, please do let me know. And if this is helpful, I'd like to hear your feedback as well on what we're doing, what we're putting together. I have sent out, just so you know, I think it starts next week on the 6th, but it's Parenting Through Resistance, Supporting Your Child's Emotional Regulation. So it's a 2-part workshop, and it does cost money for that event. It's through Decade to Connect. So I do have the information on our website. I have it also on where I sent it out in a newsletter. If you're a part of the Guiding Bright Minds, either membership or newsletter, you would have seen that, but just want to highlight that's out there. So as I mentioned, the copy of the recording will be sent out, a copy of the presentation as well. And at the end, we will allow for questions and answers. So just be sure to put that in there. So thank you all again for your time. Let me go ahead and introduce to you our 2 speakers today. And to mention that the topic for today is neurodiversity and maximizing progress through coordination of care and collaboration. So important to collaborate, because as we all know, parents, whether you have a child who's neurodivergent or not, we're seeing lots of different people at lots of different times. And how do we coordinate? And that's important to understand how we work together collaboratively. So let me introduce Mary Ann. Mary Ann has a degree from the University of Southern California with an emphasis on mental health and children and families. She's a licensed clinical social worker, and been in private practice for over 15 years and working at ACES for over 18 years, where she's been a clinical role working with clients across the lifespan as young as 1 year old and ongoing subject matter expert on dual diagnosis clients and child welfare. She's currently overseeing clinical and community outreach department at ACES. So thank you, Marianne, for joining us. And we also have Stephanie, who has a master's degree in human behavior and completion in PhD in applied behavioral analysis coursework. She's board certified behavior analyst for 10 years and in the field of ABA for over 16 years. Working at ACES for over 16 years in a clinical role, working with clients as young as 1 year and up to 47 years of age, with an expertise in co-occurring diagnoses, including anxiety, depression, childhood schizophrenia, and severe behaviors. She's currently the Director of Research and Innovation at ACES. And I also want to mention too, because you probably see Celeste on the screen as well. So Celeste has been an RBT for ACES for years, but her current role is Outreach Executive Coordinator. So welcome to this team, and your expertise and what you guys do for the community is so appreciative. So I will stop talking now and I will turn it over to you all to conduct the presentation.
Fantastic. Thank you so much, Tiffany. We're excited to be here. I'm going to go ahead and share my screen and we'll get started. I know we only have a certain amount of time today, and we do have a lot of content that we want to share with everyone. So we'll go ahead and get started with that. Let me see. Can you guys see my screen?
Yeah, just you want to put it in presentation mode?
Yeah,
okay, hold on 1 second. I know we went through this and now it's not popping.
From the beginning, that's okay.
No, the entire screen isn't popping up now. Hold on 1 sec. Let me stop share again. So share screen. Oh, it's loading. Sorry, guys. I am having issues. Stephanie, do you have the presentation?
I do.
It's not working for me. And I know we just did it, so.
Let's pivot. Alrighty, can everyone see my screen?
We can see your screen. Sorry about that.
No worries. Okay, so today's topic is neurodiversity and the importance of collaboration. I am Stephanie Shearer, the Director of Research and Innovation here at ACES. I'm here with Marianne Olinas, our wonderful pioneer with our clinical and community outreach. Our agenda today is going to be to kind of discuss what neurodiversity is, what some of the current debates are. So particularly for this presentation today, we're going to focus on the different types of service providers that are available, what the needs of the autistic community are, what has been voiced, and how ACES has kind of worked through listening to those voices over the years, pros and cons of collaboration, how a parent can contribute to the success of their child, and the benefits of coordination of care. Alrighty. So let's get started with what neurodiversity is. It is a term that refers to any variation in what, biologically we consider the wiring of the human brain. So the way someone thinks about things, the way someone responds to the stimuli in their environment. The term neurodiversity is just meant to cover that range of difference, meaning that, we all don't have the same brain. We're not going to, process information the exact same way as the person sitting next to us. And that's okay, right? That's normal variation. Biologically speaking, that's what we would expect from, any species. It can range in single variation of thinking or actions. So, we hear those terms like, oh, that person's quirky, or, they don't like to wear, maybe certain textures or things like that, right? Little things like that. Or it could be something more involved, like a neurological diagnosis. So it could be something like autism spectrum disorder or ADHD or Tourette's. We don't have to, anybody can self-identify as being neurodiverse, but there are some diagnoses, some formal diagnoses that will fall under that neurodivergent category. So like I said, autism spectrum disorder, Tourette's, learning differences, dyslexia, like we heard Tiffany kind of mention in her story, OCD, epilepsy, anxiety, right? These are known conditions that have kind of that wiring that's different than what we would consider for a neurotypical individual.
Hey, Stephanie, your screen showing your notes
Oops,
right now,
sorry.
Not the slide.
My apologies. Okay, so when we're looking at someone who is neurodiverse, we want to surround them with their strengths. We all have different strengths, and if we're coming from a place of recognizing the strengths that someone has to offer, and we're naturally tapping into their motivation and really setting them up for success in the life that they're choosing that they want to have. So we have this visual here, which just kind of gives a different array of the different kind of known diagnoses that fall under neurodivergence and where their strengths lie. So if we're looking at dyslexia, for example, right, they have higher verbal skills, they're more empathetic, they have, more tapped into intuition. So we can play into that when we're looking at things like, treatment planning or treatment modalities to help in areas where they may be struggling. So knowing that somebody, is more of a visual thinker or is more creative can really allow us to enhance the treatment plans that are being developed for them. And then at ACEs, what have we have learned so much from listening to the families and the individuals that we've worked with. ACEs has been around since 1996. So in the 27 years that we've been around, we've strived to always listen to the individuals that we work with. We've become experts in helping those that we work with navigate all aspects of life. So these are kind of some of the areas that we have heard where people need support. So accessibility. And when we're talking about accessibility, we're talking about anytime we have a disability or a diagnosis or something that's going to keep somebody out of, everyday life, they have the right, anybody has the right to make sure that they can access their life and their resources around them. So what we do at ACEs is we go out into the community with our families that we're working with and with the individuals that we're working with. And we, either maybe it's having a conversation with a restaurant before we get there to kind of talk about the situation a little bit, or to, ask for an accommodation in that environment so that they can still access that environment. Maybe it's a booth in the back of the restaurant if we're working on, just being in a busier place with an individual. Education, everybody has a right to an education. Sometimes when we're looking at a neurodiverse individual, they may need more supports in accessing that education, but it doesn't mean that they don't have that right to education. So this is where school districts come in and where IDEA, the laws that are in place to help support individuals who need extra support, still access their basic right to education. We also have, the idea of self-determination. And this is a really big one actually in the world of autism, in that everyone should have the right to make choices for themselves. And somebody shouldn't be making a choice for somebody else just because they think that they're not capable of making that choice. So in our practice at ACEs, we really work with our individuals that have the diagnosis and their support systems to show them how to advocate for themselves, how to make choices, how to communicate when, they're not happy with the situation around them. So that's really important when we're looking at, any neurodiverse individual, that they feel like that they can make the choices for their life that matter to them, and that it's not somebody, making a choice for them that they think that they should be doing. I'm just checking time. You know, other things that have come up over the years, especially as, you know, the number of individuals who are diagnosed with autism specifically, is as they continue to grow and get older and they become adults, you know, what does their, you know, community living look like? What does their access to healthcare look like? And so there's, you know, at ACEs, like myself, I'm a board certified behavior analyst. I can't make recommendations for certain areas because that's outside of my scope of practice. And, you know, Marianne will get into a little bit what scope of practice entails and why it's so important. But my role in those pieces in ABA is I can provide resources and I can point a parent or a caregiver in the direction of good quality information. Because as we know, growing up in the technology era, right, there's so much information out there. And so oftentimes it's hard to know what's better information than others that we're reading. And so that's where, you know, the clinicians that you're working with can help guide you, even if they can't make actual recommendations for these kind of specific areas. Okay, so let's talk a little bit about treatment. I always like to start off this discussion with kind of if you're going to take home anything that I say from this part of the presentation, is I want it to be wherever you choose to spend your time in treatment, make sure it's evidence-based. And when I say evidence-based, I mean it's been tested for the diagnosis that it's being used on, because oftentimes what happens with treatments for any diagnosis is that people like to kind of, you know, get involved, and, you know, some are from a helpful point and some are, you know, driven by other motivations, but they will say that, oh, come do this treatment because it's going to help your, you know, it's going to help your life. And when we're in a situation as a person where we have a diagnosis in front of us, all we want to do is make it better, make it go away, you know, anything kind of like that. And so sometimes, you know, we need to do a little bit of homework and to see which treatment options are out there that are actually proven to help this particular diagnosis. There's a lot of treatments that are out there that are proven to be effective, but they may not be proven to be effective for the specific diagnosis that you're trying to treat. So just make sure that if you're going to put in the time to go through a treatment, that it's actually meant for the diagnosis that you're intending it to be treated. And with that, we have lots of different options. So behavioral treatment typically means applied behavior analysis, which is ABA, which is what ACEs does. And we, you know, with ABA, the goal of ABA is to strengthen the skills that, you know, a learner has to help alleviate their struggles. So, you know, if socialization is a struggle and they have identified that that's an area that they want to work on for their life, then ABA can help, you know, bolster skills to help make that easier for them on a day-to-day. It also helps reduce and maintain trouble behaviors, right? So behaviors that we may be getting them in trouble at school, like Tiffany was kind of mentioning, or maybe keeping them out of that kind of community setting so they can't access their environment around them. So ABA is meant to really come in and work with the families to help support, you know, all aspects of life in that regard. When we think of developmental, we look at, you know, treatments like speech and language therapy and occupational therapy. So things that are meant to kind of help those developmental milestones that may be a struggle area for an individual. Educational, like I said, this is where the school district comes in with IEPs, individualized education plans to help support that academic piece of a learner's day-to-day life. Social relational is another area that has a lot of good treatments in it. We look at social skills groups. Again, right, it's that if socialization is the area that we want to focus on, we want to have somebody in a group because that's where they're practicing those social skills on a smaller scale before having to go out into the larger community. It's also using social skill tools like social narratives, or, you know, previously, like 5-10 years ago, they were called social stories, but individualized stories to help somebody understand the situation that's in front of them. Then we have psychological treatments. So this is if we're looking at, you know, anxiety or depression, things like that, if maybe they're co-occurring or maybe they're the primary diagnosis, but working with a licensed clinician to kind of use cognitive behavioral therapy or other kind of psychological modalities to help, you know, alleviate those symptoms. Pharmacological is medication, right? So the only one, and I always have to caveat this for our participants, is when we're looking at medication, the only one who can make a recommendation for medication is a doctor. That's their area of expertise. That's their scope of practice. And, oftentimes we hear stories of, maybe teachers making recommendations to families for medications. That's not their scope of practice. Their scope of practice is, academics. So just make sure that, if you're having that medication conversation, that it is with a prescribing doctor, and they are the ones who are going to be, experts at answering any questions related to medication, the pros, the cons, if it's the right fit for your family, so on and so forth. And then last kind of category of therapy is complementary or alternative. And this is things like, we'll see music therapy, or we'll see, other things that, may not be like special diets or supplements. Sometimes, depending on what the diagnosis is, there may be kind of alternatives that can help, like it says, complement the situation or the other therapies going on. But I will say that there is no one right therapy for any diagnosis. What's important to remember is when we're looking at a treatment plan is the best treatment plan is the one that you're going to do, and the one that you can stick with and that you can be consistent with. So it doesn't matter if, you're seeking ABA. If you are seeking ABA, great, right? I'm a little bit biased. I 100% admit that, I totally believe in ABA for lots of different things. But if you're going to commit to ABA, then showing up to all the sessions, completing all the sessions is important, because it's the consistency at the end of the day that really makes the difference. Yes, it is the modality that you choose, making sure that it's evidence-based to be effective for your diagnosis, but it's also that consistency piece. So whether you choose to focus on speech and language, maybe over behaviors, that's your personal choice, and you should know that it's your personal choice, because it needs to be, what's going to work best for your family, what's going to work best for your own personal resources, how much time and energy you have to give to treatment. But once you've decided that for yourself, making sure that then you're consistent with whatever you choose. Alrighty, so I'm going to pass it over to Marianne now, and she's going to walk through why that collaboration piece, for if you're choosing multiple treatment options, why it's so important.
Okay, taking myself off mute. Hi, everyone. So for me, I definitely have found over the years that when we look at collaborating, we just tend to see so much more progress and just rich programs being implemented within the different levels of expertise. So when we look at collaborating with different professionals working with a client, our goal is to see gains in the following areas. So we don't just have one area to target when we're working with clients. There's so many for your children. There's so many areas we want to see that progress. And so what we're looking at is setting up success and making progress in their cognition and behavior. Communication's another one. Adaptive skills, we tend to see more as they get older, that we're looking for progress to be seen there. Social skills, whole family well-being, because it's not just only about the client, it's also about the parents and all the other family members in the house. And then community integration. So when we look at setting up success through collaboration, typically there's some core key factors that need to be put in place. And again, this is just speaking from experience and working with so many different families. And I do want to preface that this isn't just specific to autism. It can be any child with any diagnosis who is needing assistance to help them progress in different areas in their life. So the first is parent involvement, extremely key. I'm going to go over what that looks like in another slide. Coordination of care. And when we talk about coordination of care, that's with different professionals that may be touching the life of your child, and what that would look like. And I'll also be going over that specifically. Treatment planning, making sure everybody knows what the ultimate goals are and that there is a treatment plan in place that we're working on reaching the goals. And then generalization of skills. You want your child to not just be successful with one particular person. You want them to be able to demonstrate those skills across different settings, different people, different situations. And so through collaboration, it helps to prevent, people from working in silos, right? And really working together cohesively to meet that ultimate goal for your child. So the next slide, Steph, yes, importance of parent and caregiver roles. So this I always stress. I tend to work a lot with parents and just build that relationship, because ultimately they are the ones that are going to be carrying on and supporting their child through life and getting them what they need to be successful. So participation and follow through is so key in order for your child to meet their goals. What we found is increased parent involvement versus less parent involvement. We see so much more generalization of skills with the children outside of therapy sessions. So we can work with it, like the speech therapist can work with your child, the occupational therapist can work with your child, mental health, us. But if we're not doing our part as parents, we'll definitely see that there's going to be some barriers to progress there. With parent caregivers, there's increased learning opportunities with the child since you're with them majority of the time. So we only have them for that small snippet of time. So if you can continue to work with them, they're obviously going to get more exposure, more learning opportunities through your involvement. And then increased parent involvement also increases your confidence, right? Not always being so dependent on asking a therapist what you should do in this situation. If you're involved in their programs and all their different therapies that they're doing, it'll help you understand why we do the certain things that we do to help your child. And then you'll see that response back from the child. Being confident in knowing how to handle different situations, I think is so key, because sometimes I'll see parents where they feel that sense of hopelessness. And what we're trying to overcome is feeling of, hey, I can help my child. I can do this. I am not hopeless. I have the tools. And to have that confidence, it's hard. It's hard to have that when you're running around doing all these different therapies. But I think for parents, what I always like to remind them is, number one, you're your child's advocate. And you're always going to be there for them. And hey, you have the tools out there with all these different therapies that you're using or utilizing for your child. So please tap into those resources and then put them in your toolbox to be able to help your child be successful. And then consistency with implementation of strategies introduced by your treatment team. So being consistent with those things that if you're inconsistent, it's gonna confuse your child. So they're not necessarily gonna know how to respond. But the more consistency that you have with different strategies that are being implemented, you'll tend to see increased skills develop in terms of what you're looking for, and then also behavior reduction. So that's kind of just highlighting why it's so important and why we incorporate parents in a lot of our programming. Don't just use that time you have with a therapist when they give you a summary of what's happening just to listen. Actually take it as, hey, you know what, I'm listening, but then I'm also going to take all of that and then I'm going to go ahead and implement it myself when I leave this session. Steph, if you can move to slide 8, 9. What slide is this one? Slide 9. Okay. So here's an example of what coordination of care looks like. And again, this is not just for a child with autism. This is for any child. This is, even if it's a child that doesn't have a diagnosis, coordination of care, when you look at success for treatment of any type of treatment, any type of learning, any type of goal, is so key for you to be successful. But as an ABA company focusing on behavior and skills training, we do have clients that may have multiple diagnoses and that might impact progress or lack of progress. So what we would do is collaborate with the following experts in their field. that we have listed on the side over here. But some of the sample target areas that we usually see here at ACEs is with those dual diagnosis clients or multiple diagnosis. Sometimes we'll have kids with a diagnosis of anxiety disorder in addition to maybe some oppositional defiant disorder. And that's where we would typically tap into mental health when we start to see behaviors that may not necessarily be due to the autism. And so seeking out that expert and working with them directly on letting them know what we're working on and then giving that input and feedback to them so they can work within their scope of practice on the specific diagnosis that they're targeting. Some of the other target areas that we look at are social skills. Usually we loop in speech therapists with that. They also help with that communication piece because communication is so key to the social skills as well. Behaviors, and this one's kind of tricky because sometimes we'll have behaviors and it really is, just behaviors that can be addressed in ABA, but sometimes we'll find that maybe there's some sensory issues going on. And so with those types of situations, that's when we would coordinate care with maybe an occupational therapist to look at, hey, what type of sensory things this is what we're seeing when this type of input's given, et cetera. And then getting their recommendations on what maybe we can incorporate within sessions and even providing that to parents in terms of strategies within the home, because there may be something sensory based that's triggering the behaviors that can easily be addressed from an OT standpoint versus a behavioral standpoint. So we do look at that. And then we look at cognitive. And so cognitive, Stephanie touched on that as well. A lot of coordination of care with schools. So sometimes schools will contract with schools and they'll want us to come in and address behaviors because the behaviors are impacting their ability to learn. If we manage the behaviors and we still see that it's impacting their ability to retain information or make progress from a cognitive level, then we can help to support that. So we've done a lot of support in the school settings as well. And then we turn to medical. If it's a physical issue, oftentimes we look at medication management. If a child's mood or behaviors dramatically shift once a medication was changed or whatever the case may be, we definitely would want to coordinate care and touch base with whether it's a psychiatrist or a physician who had prescribed that medication, because we want to try to pinpoint and obviously address where issues may lie for the child if it's impacting progress. So we do coordination of care with them. And then self-help, we work with occupational therapists on that as well. And then attendance kind of goes back to school. So if you look at this little chart that I put together, these are at least for ABA, these are the usual other service providers that we work with and we coordinate care with. And I have to say is we do client clinical reviews for clients. And sometimes it's just so important for us to get together as a team so then we can talk about why a child is having some barriers to progress and then really reaching out to those experts, right? I'm not going to act like I'm an expert in speech when I'm not. Going back to what Stephanie said, what's the best therapy? There really isn't one. It's really what's best for your child and then what's best for you as a parent in terms of where you feel like they're going to be seeing that progress and being able to make a commitment to be able to follow through on whatever therapy that you do choose for them. And then I did add parent and caregivers because parent and caregivers are definitely a huge part of that coordination of care. So you are a big part of the team as well. So here, the importance of coordination of care, I did touch on that, but really looking at having subject matter experts. So to have that resource and know that there's somebody out there that I could reach out to that's working with this child is so key. So like I said, if it's somebody who's an expert in speech, I'm going to reach out to them because I'm not going to act like I'm a speech therapist. We can support, communication goals and all that, but, sometimes the child may have apraxia, which, I don't know as much as a speech therapist. So getting their expertise on that and understanding it can help us be able to implement our program so we're not contradicting what they're doing. And then maybe potentially even harming any type of progress that can be made because maybe we're just not on the same page, or maybe we're implementing something that may be impacting the treatment that they're having there, or vice versa, that we just may not be aware of. And so having access to subject matter experts is important. Working on a common goal. We, like I had mentioned, we don't want to be working against each other. We want to be working towards that common goal. And the more you communicate what you're doing and how it's working and what's working for you, and it may not necessarily work for us, which is totally fine. But having that mindset of just understanding what's going on in different other areas is just so important to just continue to stay focused on meeting that common goal, ultimate goal that we have for a client. And then client-centered, every child's different. Every child needs a different type of therapy, and we want to be able to respect that. And then increased collaboration, as I mentioned, it just means increased progress in your child's treatment goals.
So steps we all can take is one, just to be open-minded. We don't want to assume someone's situation is our own situation. It may be similar, or there may be aspects that are the same, but everyone's on a different journey, even if it's all kind of, related to the same thing. So don't assume, like, for example, if we're talking about a person preferred language, if I say I am autistic versus I have autism, that's a personal choice for the person going through that journey. So it's always best to not assume how they want to be referred to, and listen, right? So one family's expectation, even if you find yourself as neurodiverse or your loved one is neurodiverse, your situation may be different from somebody else. And so, if you're listening, then you can help guide them from a place of support rather than a place of judgment. Because at the end of the day, right, none of us want to feel like we're being judged by somebody else for the situation that's already hard enough for us to go through. And then, for collaboration care, remembering that collaboration maximizes progress. And if there's multiple treatment therapies going on, when the teams are collaborating together, it just means that everybody that's in that family boat is rowing in the same direction. Because if we're all rowing in different directions, then, we're not capitalizing on the time that you're choosing to invest in seeking treatment. So if a clinician comes to you and asks if you will, sign off on coordinating care and collaborating with another treatment professional that's on your team, we highly recommend that you approve that. Again, that's a personal decision, but hopefully today's presentation kind of helps explain why it's really important to collaborate care. And then to know, as a parent, as a caregiver, you are part of that collaboration. So making sure to speak into, the day-to-day struggles that you're seeing for your loved one, or how it's affecting your family on a day-to-day. So that way, you're a part of that treatment plan process, and that the treatment plan that's being developed for you by any treatment team is usable in your day-to-day. Because remember, the best treatment plans are the ones that you can actually use. Mm-hmm. We do have some resources. And again, as Tiffany said, this will get sent out, but just a variety of different resources here for anybody looking at, a little bit more about what treatment options are. These ones are going to be a little bit more specific to autism, because that's our, area of expertise here at ACES. And Tiffany, I can also send you some other resources that are not autism specific, but that help kind of outline different treatment options, collaboration of care, and the like. Always put this out there. If our website at ACES has a lot of great blog posts just for other additional information, so you can always choose our or treat our website as a source of information as well. And that's what we have today. Maybe we can open it up for questions.
Thank you, Marianne and Stephanie. That was wonderful. A lot of details, a lot of information. As I mentioned earlier, please put Q&A, any questions you have in the Q&A section at the bottom. You know, one of the things that just to emphasize as far as, you know, just being a caregiver, you know, for parents and going through this process is, you know, allowing the opportunity for grace too, as we continue to learn and there's so much going on, and, you know, that opportunity for self-care, which I know is hard. And I know it's such a word that I, as a parent myself, I'm like self-care, but just even, you know, 1 minute, I started truly 1 minute of meditation where I'd count to 10, you know, 10 times, however many times I got to 10 without, you know, thoughts coming into my head, but just starting one step at a time, but just knowing, you know, as a parent, as a caregiver, trust your gut too. I was on a phone call earlier today with a parent who at every turn, and I know, you know, you guys as professionals probably have heard this, us as parents and caregivers have heard this, where we've talked to, whether it's a teacher or a professional, we're like, oh, we have this feeling, and they're like, no, it's not. It'll just take time for them to grow, or allow them, or this is the normal process. But it's hard when you have a professional telling you no, but as a parent, go with your gut. It took 4 years, this parent I talked to finally get the proper, you know, somebody to listen to say, you're right, you know, your son is autistic, has ADHD, whatever it is, to allow for that. But I guess one of the questions that I have too is, we know not everyone likes playing in the sandbox together. So how, as you as professionals, really work? I mean, I have, as a professional, as a parent, I know I have my opinion, like, you know, if we all just focused on the child, that would overcome so many obstacles, but we know people don't. So how do you work with professionals who aren't want to collaborate per se?
So for me, I'll go ahead and answer this, and it's actually happened. It happens often. For ACEs, I feel we stay genuine to what we believe in, and that is collaboration of care, because we don't pretend that we are better, and we don't pretend that we know more than other professionals in the field that may have a different specialization, because we do respect, you know, if they're licensed in there. I always say, I just stay super open-minded. I mean, my background, and I do train people here at ACEs as well, but my background's in social work. So it's all about collaboration. It's all about the child. And I don't take anything personally. I understand that they're passionate about the work that they do. And there's only so much I can do. So I feel like if I put the information out there and I try to collaborate, I did my part, right? I did my part. The parents see that genuineness. They know that it's like, well, Marianne tried, but that so-and-so is just doesn't want to collaborate with them. And it's unfortunate because in the end, it ultimately impacts the child with regards to progress. So for us, I think that's one of our strengths. And I'd like to say that a lot of companies, even other ABA companies, like working with ACEs because we are very open and collaborative. It's actually part of our mission. And so that's just what our mission and values. And so I think for me, that's typically my approach. And it wouldn't mean that I wouldn't go back and try to collaborate with that person again, because maybe it was just a bad day or a bad month or whatever the case may be. But at some point, you know, either they'll want to give in and say, okay, fine, I'm open a meeting with you. I'll go ahead and have a meeting. Let's go ahead and talk about this. Or they might just, you know, continue to ignore us and we just need to move on from there and hope the parents will make, you know, the right choices and understand, you know, why, you know, maybe some progress isn't as good as it can be, right?
Is there an opportunity in those situations for the parent to get involved? I mean, that's the one thing, because ultimately we're kind of that CEO of our child's, you know, coordination of care. But with all the other responsibilities, I know the thought of that seems overwhelming, but I think there is an opportunity and an obligation to say, you know, how could I can't fathom why you wouldn't want to play and work together and collaboratively. But I think, yeah, there is an opportunity, obviously, for us as parents to definitely help facilitate as best as we can. But and that's a good thing to note. As you know, I'm a huge proponent on interviewing at least 3 providers before making a decision. And I know it's hard because, you know, that's the thing, is what to do and what to ask for. But that's a great one to put on your questions when you're talking to providers, is how well do you collaborate with others? Because this is a team, this is a group effort. And just as you mentioned throughout this, it's not just a one size fits all. It's not just one therapy that's the end all be. I mean, it is a collaboration, because we know that most of our kids have comorbidities. Most of them have so many other things. And we want to incorporate fun time for them too, like the extracurricular time where they can enjoy and focus on their strengths as well. So there's that opportunity for that. So thank you. Let me see. Any questions? Does anyone have any in the Q&A? I don't see any popping up. Anyone else have any questions?
I think I see one. What this it's from Nancy. What are some of the things I can look for when looking for culturally responsive care from providers?
Nancy, that's a great question. Marianne, do you want me to go ahead and take this one?
Yeah, go ahead and take it.
Sure. So one of the things, and you know, we emphasize this, and Tiffany, I'm glad you brought up questions and interviewing providers, because even though every treatment discipline is its own discipline and it's based in science or whatever, you know, it's based in theory, it doesn't mean it's every provider is going to implement it the same way. And so it's important to, you know, find a provider that aligns best with, you know, how you live your life, how you want to live your life, and because then you're going to trust the recommendations that are coming from them. And that trust piece with your providers is very, very important. And as Nancy is asking, that culturally responsive care is one of those key pieces, especially now. You know, we live in a world now where we interact with so many different people on a day-to-day basis, right? It's, you know, we're not just in our own little village anymore. Where, you know, I can talk right now with somebody in another country because, you know, technology has advanced so much. So it's really important to look at even like the little things. So we train our staff at ACEs, and I, you know, work with the parents and caregivers on a day-to-day basis to, if you're come from a culture that, let's say, doesn't want their shoes on in their house, if your treatment team is honoring that, and the second they get to your house, their shoes are off and before they enter, right? Like, that's how you can kind of tell if you're working with a group of individuals that's culturally responsive. If, you know, they ask, right, if you're going through intake paperwork with a particular treatment provider, and it's in their intake paperwork of, do you have any cultural considerations that we need to be aware of? That's really important too, because it means that they have it's built into their company culture that they want to know these types of things and roll it up into your treatment plan and their interaction with you. Yeah.
I want to add, just because we recently gone through this, and we have a family that's now going into their second year here at ACEs that travel in from Indonesia. And they don't have services out there. So they come in, mind you, you know, English is a little bit tougher, but thankfully, you know, the child is bilingual. And that's one of the questions that they had asked is, can you describe the process, is one of the biggest things, is what's the process look like from beginning to end, meaning from the start of intake to assessment to treatment, because we only have 3 months here and I want to know what we're signing up for, right? And so spending that time with them to really help them feel comfortable, because you could tell that it's just not, you know, something they're familiar with. So if you find a service provider that is willing to listen and to hear your concerns. And maybe there definitely were some things we could not accommodate. But if it was fair and we're flexible, and you feel like, okay, I think we can do this, and you felt like there was that level of respect, they, like I said, they came back a second year, and so they've been with ACEs. But one of their biggest things was us collaborating with their speech therapist that they also had here that they'd been working with remotely, and we said absolutely. And then yeah, it's just I feel like just being heard, I think, is important, because they may not, like, service providers may not know. I'm not going to act like I know every single culture out there, but if you're going to probably have to educate them. And so if there's something that doesn't feel right, or it feels a little uncomfortable, I would just say something, because it may not be intentional, right? It could just be the way they practice, and maybe they didn't know. And as soon as you speak up, it can get resolved, versus holding in some of that anger or anything like that. So that's what I recommend.
Yeah, and that's, what we recommend is that role of your collaborator as a caregiver is, like Tiffany was mentioning, like Marianne was mentioning, you're going to know as a caregiver, as a parent, like, the situation isn't feeling right. And when you can say something about it to your provider sooner and not kind of let it fester and escalate, then, that positive therapeutic relationship more often than not can continue. And you've just strengthened the skill set of your clinician, which is always an amazing thing to do, because we are a accumulation of our experiences in life. And that is part of our experience. None of us know what we don't know until we don't know it. And, being able to have that open communication and that easy communication with any provider you're working with is going to be really important at the end of the day for your overall progress.
Yeah. And that was one of the things as a parent, it's like, trust, and I go back to that gut instinct, but also, don't prolong things that you don't think is right either. Because I have so many parents I've talked to, and my own self of, I don't want to change another provider, but and you have to allow time for progress too. It's not like it's going to happen in a week. I mean, so there has to be a grace period, obviously, of building that relationship and setting realistic expectations as a parent. I know that was hard for me, but also knowing when it is time to move on or find somebody, or this is more detrimental, or I touch so many parents, especially with schools, but if your child's crying every day, it's that's time to really consider pulling what that looks like. And I know, again, it puts a lot of burden on us of that research and what do we do and how do we do that. Just like when my son was in the principal's office every day, I'm like, it's a half day kindergarten, it's 4 hours. It's heart-wrenching what our kids go through, but that's where, just to find that team and that tribe that supports us from the professional standpoint. And that's kind of the purpose of Guiding Bright Minds, is creating, I vet all the professionals. And that's why I even say, just because they're in there too and vetted and qualified, you still should choose from 3 options and still interview and use that opportunity to say, here's clearly what I want for my child, and collaborate together, because they might say this might help too. But yeah, just go with that feeling and support and finding those that truly, because that makes all the difference, obviously, for you as a parent, but most important for the child too, and their success and growth.
Yeah, exactly.
I don't see any other questions. Anyone else have anything else? This was such great information. As I mentioned, the presentation and the recording will be sent out later this week. To you, some other things, but anyone else, I appreciate so much what ACES does, what you guys provide, the heart that you have for helping. And I know, working with families and collaborating with professionals is so key to that, as we just mentioned today. Thank you for all the people in the chat that are saying great presentation. It was helpful and I'm enjoying this. We appreciate your time as well, because I know it takes a lot out of our day and things that we could be doing, but knowing that this is important too and critical to our children's success. So Marianne, Stephanie, Celeste, Thank you all. I don't see anything else hopping in, so I'm going to say goodbye to everyone. Check out our next webinar. I haven't posted yet. I don't know what it is yet, but we'll get something up for sure. So everyone have a great afternoon.
Thank you. Thank you for having us.
Thank
Yes,
you.
Bye.